Hello everyone. Today I want to talk to you about releasing records to another practice. So let's say dental practice ring your office or send you an email that they require all the records for a certain patients. And I want to share with you two important things that hopefully will minimize your chance of getting formal complaint, especially if this case didn't go as planned or the patient is not happy with treatment. So let me share that with you, and I will share with you a recent story as well that triggered me recording that video. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And I took it from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members now and growing. And you can check my details below for credibility. So I had a situation, I'll give you the example first and explain to you the two key things that we do before we release records. Situation is, let's say, for example, I don't want to get into the details of this case, but let's say I have a patient and this patient had a certain bite. Let's say a class 3 bite. There is a bit of a class 3 where the bottom jaw is ahead of the top jaw, but they can bring the jaw to an edge-to-edge position. And they have a bit of gum recession in some areas in their mouth as well. And let's say this patient, you went through a lot of different options with them, that ideally you want to see a periodontist, get gum grafting, see an orthodontist to discuss orthodontic surgery to bring the maxilla forward, to bring the mandible back and get everything perfected. And that is the ideal plan. That's what we recommend. Patients say, look, I really don't want to go any of that. Is there another plan? Let's say they can get to edge and you realize, okay, we have a compromise here. Maybe we can just open a bit of space on the upper arch. Maybe we can close some of the space on the lower arch and get you a little bit out of edge to edge, and maybe do some resin buildups on the back teeth. We're doing minimal movements on your teeth to avoid any further recession. And we're not gonna perfect everything without an orthodontic surgery, but hopefully we can make things better. That's not an ideal plan, but that's what we suggest for you. And let's say you do this treatment over a certain number of years, let's say 2 years, I'm giving you examples. And then 3 or 4 years later, you get this email that the patient requiring records release. Now, mistake number one is you just release the records straight away to the other dentist. I suggest two things. Number one, calling the patient first just to confirm they definitely want the records released and the reason. Kind of like a feedback. Look, we received this phone call or this request from another dentist. We're happy to send the records, of course. We're going to prepare that for you. But we have a protocol or a system in place where we check on patients before we release the records. Number one, to confirm that they definitely want to have all the records transferred to another dentist. They don't want to see us anymore. Number two, if they can provide us with a feedback, if anything we've done that triggers that, we need to know so we can hopefully learn from it, or maybe we can fix this up for you. And patient in the phone call said that they went to another dentist and the other dentist looked at their mouth. Oh, you have a lot of gum recession. Your bite is off. Then they tell them, I had some orthodontic treatment. Yeah, the ortho probably caused that gum recession. They refer them to a specialist. The specialist says, yeah, your teeth has moved in the wrong direction. That's why your gums are receding. Now, all of these judgments, human beings, I mean, if I'm the person seeing this patient, I wouldn't judge unless I see the pre-records or know exactly what happened. But we're dealing with human beings, so maybe the clinicians had the good intention and they really don't have the previous records and they jumped into conclusions. But what happened, the patient hears information and they will think something went wrong. So we got at least this from the phone call. We understand now the patient is unhappy. The patient has been receiving certain information. It might be incorrect and possibly definitely incorrect. And that gives us a bit of opportunity sometimes to ask the patient, hey, would you like to come back? But if the trust is broken, I would suggest not bringing the patient back, because the trust is really being gone, so you don't want to try to pat it back and win the trust again. Then the second piece of information, so first one is to call the patient, understand, confirm that he wants the records released and the reason, so you get more information. Second information, don't just release the records. Attach with it, what I suggest, a letter. I call it a release letter, a record release letter. This letter you can explain in summary, because the notes are huge. There's a lot of photos, there's a lot of x-rays, especially with big cases. Just a summary, what was discussed, what treatment was provided, and how the patient went with the treatment and so on. This will give the other clinician, when they read the letter, a bit of understanding. And then they might change their point of view. They might look at the letter, I can see this dentist or this practitioner actually discussed orthodontic surgery and orthodontics with a specialist. They offered the patient to see a gum specialist. The patient rejected, declined really strongly doing gum grafting. we can see now from the previous records, I can explain that if you can see the previous records and the after records, we did minimal movements to prevent any further recession. We just simply did really, maybe within 2 millimeters of movements. And patient didn't wear the retainers, and there's some relapse. They came back, we had to do retreatment, and they didn't wear the retainers again. I mean, you can have a chance just to provide a quick summary of the other things that the other clinician might not know. And then this will hopefully help them to tell the patient, yeah, I can see now what happened. And, you know, it's just the discussion can be different compared to like, your teeth has moved in the wrong direction because of orthodontics, and that's why where you are. Now they can understand, hopefully the chance of the patient now reacting and putting a formal complaint against you will be low. Could be a full mouth rehab case, could be a single tooth replacement, could be a crown that didn't go well. But again, if you have a quick summary with the records, look, hey, we really discussed this in details, and we discussed there is a chance this might happen, and the patient didn't come to this appointment or failed to attend 4 times in a row, and that's why things went in the wrong direction. It just gives them a bit of different overview instead of going through long items in the notes. So number 1, make sure you contact the patient to confirm that they want their records released. I suggest once the patient flags malpractice or something wrong in your practice or in your treatment, my suggestion and the advice I got from the indemnity as well is do not try to bring the patient back and retreat or engage with them. I think if the trust is broken, it's hard to rebuild, and it's better just to let them see someone else or see a specialist. So number 1, contact the patient. Number 2, send a release letter with the records to give them a summary of what was discussed and what happened as well. Then of course give all the records. It's very important, and try to classify this is before, this during, this after. Just make it easier for the other clinician to find the key information so they don't miss some important information. So hopefully this can help you. If you think this is helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and I will you'll be notified when more records or more videos, not records, more videos are released. Thank you so much for listening to me. It means a lot to me.